Thank you very much. That's a very tough act to follow, Dr. Martin. Thank you very much. Let me just first say I'm very happy I had the opportunity to be here with you this afternoon. In fact, the President Pro Tem of the Senate allowed me to be excused from session so I could be here at the meeting. That's how important it is. And let me thank the board so much for having this series of public meetings. This is so important to give the community an opportunity to give you their thoughts on how important it is to keep our hospital open. As you all know, I've been working for over 1.5 years to try to figure out some way to make sure that we continue to keep our community hospital open here in San Leandro. And in fact, I even authored legislation that passed both houses of the legislature that would have required a vote of the people before there was any closure of this district hospital. Sadly, the governor vetoed that measure, but at least the legislature passed that bill. This meeting is so critical today, and I'm not going to repeat what other people have said, but obviously we don't want to close our emergency room. We don't want to lose our doctors who have been working at that hospital for years, and Dr. Martin made the point. They will leave, they will move to nearby other hospitals. So we will lose all of that as well. We see 27,000 people a year in that emergency room, and that's 75 patients a day. Where will they go? Let's just continue to work together and make sure we find a solution to keep our community hospital open. I strongly urge you not to do anything, take any action that would transfer San Leandro Hospital until you have explored every single option. And one thing, thank you. One thing I just want to mention, I heard some people talking in the room today that the only option is for the hospital to be taken over by the county for acute rehab, and otherwise the hospital will close. That's absolutely not true. We're concerned about acute rehab, but we also know that that would mean the emergency room would close, and that just should not happen. So let's work together. Let's do what we can. It does not make sense to close a hospital that is seismically retrofit. And the one last thing I would say is I disagree with something that was said earlier. I do believe that this board has the courage to do the right thing and do what needs to be done to keep our hospital open, and that's why we're all here. Thank you all very much.